Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. Today I have Kellie. Kellie, thank you for joining me.
Thank you for having me. I'm well, thank you so much.
Good. Can you tell the viewing audience a little bit about what you do here at Community Hospital?
Yeah, I am a sleep navigator nurse. Prior to that, I was with ICU in the intensive care unit for 17 years. Yeah. So while I was in the ICU, there was a lot of patients who had sleep apnea, and at the time, I didn't think it was that important, and now I find it's super important to your overall health to treat, to find out, move forward with the correct pathway that works for you. So now I'm on that side of things, and I find it very interesting and beneficial to help the public.
That's great. Sleep is such an important aspect of life. People don't understand the concept of lifespan and health span, where lifespan is just the age we live to, but health span is how healthy we are to that age. And sleep has been documented as one of the most important aspects, or one of the most important aspects of that health span. Here at the Sleep Center, can you talk a little bit about what we look for and how we do it?
Yes, we love to help patients who are struggling with their sleep because they need to be investigated typically with a sleep study to further investigate, are you having pausing in your breathing, are you just tired, snoring? You don't have sleep apnea, maybe you are snoring and pausing your breathing and you have sleep apnea, we need to develop a treatment plan to move forward. And so here at the Sleep Lab, we can help have a conversation, reach out to your providers, work that process for them. If they want to get you over to the Sleep Lab, we help accommodate and facilitate that for the patient and then reach out with next steps to keep you apprised.
Well, and it's funny, a lot of people don't even know they have sleep apnea.
Isn't that true? Yes, they just think they're snoring and I'll sleep one day later on in life, but if you don't sleep well currently, then you're already compounding your health problems and could lead to other things like heart disease, stroke, or atrial fibrillation. There's a direct correlation that we found. So sleep is super important.
Yeah, it's funny that people don't realize the impact that bad sleep has on their overall health. So let me ask you, talk to me about the day in life of a person coming for a sleep study. What do they have to expect?
A person that's going to come to the Sleep Lab, we ask them to not take a nap throughout the day so that you can come to an external place and fall asleep. I promise you will fall asleep. Everybody thinks they won't. You will. It might take you a little bit, but we are here to help get you to fall asleep, stay in our facility, wire you up, understand what's going on with your brain waves, your heart rhythm. Do you have pauses? Are your limbs moving that's causing you to be tired? Maybe you're just snoring. So lots of things go into it, but we would invite you to come to the lab around 8 p.m., stay the night, and then leave around 5 or 6 in the morning, and then about 14 days later you get a sleep study result into your MyChart.
So what happens when you get a positive sleep study? What's the next steps?
Yeah, the next step is to be talked to about it, right? What does it mean to have it? If we leave it untreated, this is what could happen, but this is the way to move forward to treat it. You need to have a conversation with the provider or myself. I get you over to your provider, get you set up with a sleep specialist to develop what is it going to start with, a CPAP, oral appliance, multiple modalities to treat sleep apnea nowadays.
Yeah, we always see those people that have the CPAP machines, right? We know them, but there are surgical interventions. There's so many other things.
Pills.
There's pills.
Medications, lifestyle modifications, of course. There's non-invasive, lots of non-invasive options, so non-cutting, non-surgical options to treat sleep apnea currently, which I love because not everybody needs an implant or a surgical option. However, there's lots of patients who do need that. But we need to start with step A, which is usually the non-cutting, the non-surgical options. So I'm your go-to person to help answer those questions.
So there's an event coming up. Catching Z's? Is that catching quality Z's?
We're trying.
Yeah,
Catching quality Z's.
Yeah, so can you tell us a little bit about that?
We want to raise awareness to the public. We want to get you guys in to see us, come have a conversation, talk to us about what your issues are. Are you struggling? What is it you're struggling with so that we can help you move forward accordingly? So it's a big event. We're going to have multiple vendors there to help educate. We're going to have our nurse practitioner talk to you about maybe you want a medication for weight loss. We have multiple vendors for CPAP equipment, how we do our sleep studies. We have their company coming, so lots of people there to help raise awareness.
So where is it and when is it?
Yes, it is March 10th. It is from 5 to 7 p.m. It is located at our Center for Visual and Performing Arts in Munster off Ridge Road.
I really appreciate everything you're doing to educate our community, to ensure that people get that quality sleep that you guys deserve.
Yes.
Thank you, Kellie, for joining me.
Awesome.
And
Thank you.
We're going to see you guys next time on Community Beat.